Auzubillahiminash-shaytanir-rajim. Bismillahir-rahmanir-rahim. Assalamu alaikum. My name is Sayyida Aska Haroon and my roll number is BP1650224. I belong to the Prof 4th. My group number is 50 and the topic that is assigned to me is Polycystic Ovary Syndrome, which is related to the disorder of menstrual cycle. Polycystic Ovary Syndrome. Polycystic ovary syndrome is a hormonal disorder common among women of reproductive age. Women with polycystic ovary syndromes may have infrequent or prolonged menstrual periods or excessive male hormone levels. The ovaries may develop numerous small collections of fluid and fail to regularly release those eggs in their eggs. The common symptoms of polycystic ovary syndromes are irregular periods, which defines as infrequent, irregular, or prolonged menstrual cycles are the most common sign of PCOS. For example, you might have fewer than 9 periods a year, more than 35 days between periods, and abnormally heavy periods. Excessive androgen, elevated levels of male hormone may result in physical signs such as excessive and facial and body hairs, and occasionally severe acne and male pattern baldness. Polycystic ovaries. Your ovaries might be enlarged and contain follicles that surround the eggs. As a result, the ovaries might fail to function regularly. Causes. The most common causes of polycystic ovary syndromes are excess of insulin. Insulin is the hormone produced in the pancreas that allows cells to use sugar, your body's primary energy supply. If your cells become resistant to the action of insulin, then your blood sugar levels can rise and your body might produce more insulin. Excess insulin might increase androgen production and cause difficulty with ovulation. Low-grade inflammation. This term is used to describe white blood cells production of substance to fight infection. Research has shown that women with PCOS have a type of low-grade inflammation that stimulates polycystic ovaries to produce androgens, which can lead to heart and blood vessels problems. Heredity. Research suggests that certain genes might be linked to PCOS. Excess androgen. The ovaries might produce abnormally high levels of androgen, resulting in hirsutism and acne. The complications of PCOS are infertility, gestational diabetes or pregnancy-induced high blood pressure, miscarriage or premature birth, non-alcoholic steatohepatitis, a severe liver inflammation caused by the fat accumulation in the liver, metabolic syndrome, type 2 diabetes, sleep apnea, depression, anxiety, and eating disorders, abnormal uterine bleeding, or cancer of the uterine lining. As we discuss the PCOs, we further found the case studies related to them, and the first case we study right now are a female successfully used oral contraceptives for 10 years. After getting married 3 years ago, the female and husband decided to have children. She lost 30 pounds with weight and exercise when she got married and has been able to maintain that weight loss. They have been trying to get pregnant for the last 18 months. The reason of infertility has been identified as oligoovulation associated with PCOS. What treatments for ovulation induction should be used and why? As we take the soap notes for them, the major complaint is infertility, which is due to the oligoovulation associated with PCOS. We further describe the subject as the basic problem is facing that the person facing infertility for 18 months. Characterization is that she is maintaining her weight loss or she is maintaining the weight that she has lost. Medical history: taking oral contraceptives for 10 years. Allergies: she doesn't have any allergy. Then we take the physical examination, which are detailed in normal limits. After taking as we further move, we take the plan and we discuss it by discussing the history. Then we further goes to the management. The common management is colimorphine citrate. The colimorphine citrate induces ovulation as anti-estrogen effect on the hypothalamus. GnRH secretion is increased, which increase the LH and FSH production. The increase in FSH concentration causes appropriate follicle development and estrogen secretion, which produces a positive feedback on the hypothalamus pituitary system to create a LH surge ovulation. The usual initial dose of clomiphene citrate is 50 mg orally daily for 5 days, started on day 5 after spontaneous or progestin-induced menses. If ovulation does not occur, the dose can be increased by 50 mg daily up to 150 mg daily. A repeat cycle can be administered as early as 30 days after the previous cycle as long as pregnancy has not been occurred. If conception does not occur, women can use clomiphene for 3 to 4 cycles. If the person is become resistant to the clomiphene citrate, then the other agents can be metformin alone or in combination with clomiphene citrate, dexamethasone in combination with clomiphene citrate, aromatase inhibitors, or ovarian drilling or controlled ovarian stimulation when gonadotropins can be recommended. Lifestyle management. For lifestyle management, the patient can take healthy diet and maintain it, then the aerobics exercises and reduce their weight, as weight loss usually happens or helps in for pregnancy and it lowers the chances of miscarriage. Notes. The last note can be taken as weight loss improves pregnancy rates and reduces miscarriage rate with PCOS. Clomiphene citrate is the pharmacological agent of choice in the woman for PCOS. If the PCOS, clomiphene citrate can only be used for a limited number of cycles and resistance can occur, so other agents are used. As we discuss the PCOS, so we got to know about how and why this occurs and how we can fight it or manage it in other patients, women. Thank you.